Hello and welcome. Today, we're going to be demystifying a really important topic that touches a lot of families: the treatment options for something called malignant pleural effusion. Our goal here is to walk through what's available, hopefully making the path forward just a little bit clearer for you.
Okay, so let's dive right in. First things first, what exactly are we talking about? Well, malignant pleural effusion, or MPE for short, is what happens when cancer causes fluid to build up in that little space around the lungs. And it's actually pretty common. It affects about 15% of all people with cancer at some point during their illness.
Now, this is really important to understand. The philosophy behind treating MPE is very clear. The main goal isn't just to get rid of the fluid, it's about palliative care, meaning the focus is on controlling symptoms and, above all else, optimizing a person's quality of life. It's about comfort and living better.
And that leads us to the big question, right? For pretty much everyone dealing with NPE, the biggest, most frustrating symptom is this really scary feeling of being out of breath. So when that starts happening, what can you actually do about it? What are the options on the table?
To answer that, we first have to get a really good handle on the problem itself, why this fluid is such a big deal, and what kind of impact it has.
So, you can imagine as this fluid builds up, it starts to squeeze the lung. It literally leaves less and less room for your lung to expand when you take a breath. And that's what causes that breathlessness, which, as you can guess, can make just walking across a room feel like a marathon. Relieving that pressure is what this is all about.
Okay, so what's the first step for most people? Well, it's usually a procedure that gives some immediate relief, even if it's just for a little while.
That procedure is called a therapeutic thoracostes. It sounds complicated, but it's a pretty straightforward process. It's often done as a day case, where a doctor simply uses a needle to drain out that extra fluid. Not only does this help you breathe easier almost instantly, but it also gives the doctors some really important clues to help plan what to do next. So here's the key thing to remember about this. A thoracentesis is fantastic for quick relief. It works and it helps with diagnosis. But, and this is a big but, it is not a long-term fix. That fluid almost always comes back. In fact, about a third of people need to have it done again within just 2 weeks. So it's clear that a more permanent plan is needed.
And this is where patients and their families get to a really big decision point. It's like a fork in the road, where you have to choose a long-term strategy for managing this fluid.
And really, it boils down to two main approaches. You can think of them as path number one, the hospital fix, where the goal is to permanently stop the fluid from building up again, and then there's path number two, the home solution, which is all about empowering you to manage your own symptoms from the comfort of home. Two very different philosophies.
All right, let's dig into that first path, the hospital-based approach that aims to seal the leak for good. This procedure is called pleurodesis. The idea behind pleurodesis is actually pretty clever. Doctors use a substance, usually a sterile talc powder, and put it into that space around the lung. This causes a little bit of inflammation, which sounds bad, but it's a good thing here, because it makes the two layers of the lung lining stick to each other. It basically glues that space shut, so fluid has nowhere to collect. So here's how it works. First, a small chest tube is put in to drain out all of the fluid. Then, that talc mixture is put in through the same tube. Now, for those two linings to stick together properly, you do have to stay in the hospital for a bit, usually somewhere between 4 and 7 days.
So why go through all that? Well, here's the payoff. The biggest advantage of pleurodesis is its success rate. It's really effective. As you can see here, it works, meaning it stops the fluid from coming back in about 80% of people. That is a huge deal if you're looking for a permanent fix.
Okay, so that's the hospital fix. Now let's switch gears and look at the second path. This one is all about prioritizing comfort, control, and spending as little time in the hospital as possible. This involves something called an indwelling pleural catheter, or an IPC.
An IPC is basically a small, soft tube that's placed in the chest and left there for as long as it's needed. The end of it stays just outside the body with a little cap on it. You can think of it like having a small tap installed. Whenever you start to feel breathless, you or a family member can just connect a special bottle and drain the fluid right there at home. And this really gets to the heart of the trade-off with an IPC. The upsides are massive, right? It's put in during a simple day case procedure. It means way less time in the hospital, and it puts you in the driver's seat for your own symptom relief. On the flip side, it means you have the ongoing job of draining at home. And there is a small risk of infection, around 5%, according to the data. And here's the other big trade-off when it comes to a permanent fix. Sometimes just having the IPC in there is enough to make the fluid stop on its own. That's called autopleurodesis. But as you can see, that only happens in about 40% of cases. That's quite a bit lower than the 80% success rate you get with the talc procedure in the hospital. So there you have it. Two really great, but very different options. On one hand, a highly successful procedure that means a hospital stay. On the other, a flexible, at-home solution. So how on earth do you and your doctor decide which path is the right one for you?
This table lays it all out so clearly. It really is a balancing act. Is the primary goal a permanent fix, or is it symptom control at home? Are you willing to trade a week in the hospital for an 80% shot at never dealing with this again? Or is keeping that hospital time to an absolute minimum the most important thing? Even the burden is different, the discomfort of a procedure versus the ongoing task of draining at home.
Now, of course, it's not just about what you prefer. There are some really important medical factors that help guide this decision too. Your doctor is going to look at your overall health, your prognosis, and one really critical thing called a non-expandable lung. Basically, that means the lung is sort of trapped and can't inflate all the way to touch the chest wall. And if the lung linings can't touch, pleurodesis just isn't going to work.
So the decision becomes very personalized. They'll look at the type of cancer, your overall fitness, even some specific markers in your blood. All of these give clues, but honestly, that last one is often the deciding factor. If you have a non-expandable lung, the choice becomes very clear. An IPC is the best way to manage your symptoms.
So at the end of the day, what this all comes down to is that there is no one-size-fits-all answer. There's no single best choice for everybody. The right path forward is found in a good, honest conversation between you, your family, and your medical team. It's a shared decision where you balance the clinical facts with what's most important to you personally.
And that really leaves us with one final, empowering question to think about. For you, in your life right now, what is the most valuable currency? Is it taking a shot at a permanent fix, even if it costs you a week in the hospital? Or is the most precious thing having more time at home with a solution that puts you in control? Answering that question is the first and most important step.